My name is Jeremy Rocha, and today I'll be examining the impact of the Paleolithic diet on obesity, metabolism, and overall health outcome. My research question: is a paleo diet the best option for a healthy lifestyle? There are countless fad diets online, and many lead to the same thing: weight loss, primarily due to an underconsumption of calories compared to the amount consumed pre diet. I'm not saying that some of those diets are bad, but I think it's important to consider different routes of achieving weight loss, especially if there's a more sustainable way to lose weight. I decided to research the paleo diet because it's of interest to me, and I'd like to compare the results of its scientific literature to other fad diets currently being promoted. Obesity rates in the United States alone have risen to an epidemic level of prevalence. Data reported by the Centers for Disease Control showed that in 2018, the rate of obesity prevalence was 42.4% in the United States. The issue with a high rate of obesity is the health outcomes associated with the disease. The CDC says heart disease, stroke, type 2 diabetes, and certain types of cancer are the most common obesity-related conditions. It should be noted that heart disease is the leading cause of death in the United States, meaning that the increasing number of diagnosed obese people will inevitably increase the number of deaths from heart disease. Type 2 diabetes mellitus, which is diagnosed due to insulin resistance, is a major diagnosis associated with being obese. Aside from medication like insulin, the only known treatment for type 2 diabetes is physical activity or diet and, as a result, weight loss. The effect of the Paleolithic diet on both obesity and type 2 diabetes will be discussed later. Metabolism is defined as the continuous bodily processes that allow life and normal functioning. Although metabolic rate is determined by many factors, the most relevant to my topic is muscle to fat ratio. If a Paleolithic diet can help reduce the amount of fat in the body more than other popular diets can, there may be evidence supporting the suggestion of the diet to people with a low metabolism. In this case, it might also apply to those with obesity, as a higher metabolic rate will inevitably increase weight loss. It may be hard to prove the effects of the diet alone, as physical activity levels play a large role in both weight loss and metabolic rate, but the scientific literature examining the Paleolithic diet shall be evaluated to attempt to draw a conclusion. The Paleolithic diet consists of meat, fish, poultry, eggs, fruit, vegetables, tree nuts, canola oil, mayonnaise, and honey. The diet lacks both dairy and refined grain products and resembles that of our hunter-gathering ancestors. It is sometimes referred to as the caveman or Stone Age diet, avoiding foods that became popular after farming was introduced 10,000 years ago. Masharani et al. Study compared the Paleolithic diet's effects and the ADA recommended diet's effects on 23 people diagnosed with type 2 diabetes. They tracked the weight of each individual to prevent weight loss, ensuring that the results were brought about by the diet alone and not the associated weight loss typical with a more restrictive diet. The results showed that those who had followed the paleo diet had seen a similar improvement in insulin sensitivity to those who had followed the ADA recommended diet. The study supports the idea that the paleo diet can help improve oneself, but not in a more efficient manner than another recommended diet would. In another study conducted by Stomby et al., the paleo diet was studied in two groups. One group followed the paleo diet alone, while the other followed the paleo diet and a supervised exercise intervention. The study aimed to determine the paleo diet effects on metabolic factors with and without additional weight loss promotion. In 32 participants diagnosed with type 2 diabetes, the results showed that there were similar effects of a Paleolithic diet with and without exercise intervention. The group that received exercise supervision did see a greater reduction in fasting glucose levels, although results were significant in both groups. Most importantly, both groups showed a significant improvement in rate of glucose disappearance, suggesting that the Paleolithic diet has a positive effect on insulin function in type 2 diabetes patients. The prior studies have focused on obese individuals diagnosed with type 2 diabetes. In a study conducted by Ganoni et al., effects of the Paleolithic diet were examined in relation to gut health and microbiota. While the results of the study weren't relevant to my research question, results showed that in both a group of strict adherences to a Paleolithic and a pseudo Paleolithic diet, levels of cholesterol were elevated compared to the control group. Furthermore, HDL levels were elevated in both Paleolithic diet groups, likely because of the high consumption of red meat in the diet. For someone with the worry of high cholesterol, a Paleolithic diet might not be recommended. The studies agree on many things. First, they all show that waist circumference, weight, and other anthropometric measurements decrease. However, this could be due to the intake of less calories. The studies all agree that the effects are similar to other recommended diets, and Masharani et al. Even state this in their discussion section. If anything, the Paleolithic diet might not be the safest option, as shown by elevated HDL and overall cholesterol levels in the study by Ganoni et al. In addition, the Paleolithic diet might not be the most sustainable. A diet lacking grains and dairy products is somewhat unrealistic for the average person. The reduction of processed foods, as promoted in the paleo diet, is probably the driving factor of many of the health benefits, which suggests that the average human might benefit from cutting out highly processed foods and find it unnecessary to follow a strict Paleolithic diet. Thank you.